So, as I have introduced ourselves before, I am the citizen from Halcyon, and today we are here to convey a message that has been told to us by our parents and grandparents for a long time, that eat fresh and stay healthy, which roughly translates into সতেজ খাবার সুস্থ জীবন, which we have selected as our tagline for our promotional program. Now, to remain healthy, sometimes we need to take medications, but nowadays our major concern is a large number of medications are sold without any types of prescriptions. From an independent survey, we saw that 56.2% people believe that drugs should be bought with prescriptions, but what we saw that they are not actually sticking to their beliefs. They are buying drugs without prescriptions, which translates into the percentage 83.4%. They are actually, these percentages of people are buying drugs without prescriptions. So we have marked it with a red circle. Now, why people are buying drugs without any types of prescriptions? It's because there is an easy availability of drugs in the market now, and the past experience and prior assumptions, which leads into the belief that a consumer who takes drugs, he or she has suffered from a disease before, so she should take the same medicine later in her or his life. And another one is the level of education, which results into distrust over the physicians. They actually don't trust the physicians that they are seeing. Now the presentation will be taken over by my teammate Roger.
Thank you. Now let's look at the core problem. The people are falling sick. Let's look at the problems. First of all, people are not simply following the healthy food diet. People are giving in to the tasty and obviously unhealthy food habits. We see that there are many restaurants in our city, and we see that they are enjoying food there, but the problem is that the food is just simply not healthy. And unfortunately, if we make sure that the food is healthy, but the problem is that adulteration issue is going on, and it has been the issue for past several years, and a lot of precautions has been taken into account, but simply it hasn't been eradicated yet. And the third point is the lack of physical exercise. Now, recently, people in the urban area, they have been interested in physical exercise, but the thing is that it's been popular among the older generation. Unfortunately, in the city, more and more people are they are engaged in desk job. So it's the issue that they should be doing more and more physical exercise has not been fully realized. And what happens is that when they approach the old age, the health problem, that thing worsens and they fall sick. And next is unfortunately, the lack of nutrition knowledge exists in our culture. The thing is that many people have been following a diet for many years and over again, but they just simply don't know that this food habit is affecting them in which way. That's a very unfortunate reason. And the last problem is that the drug dependency. We fall sick and we take drugs. We get healthy, but unfortunately the thing is not that simple. And the drug dependency, it worsens and it never takes a better turn. So what happens is that there are actually many diseases which arise from this drug dependency. We know that the kidney problems, they arise from taking actually more and more remedies. And so this is a problem we are facing. Now, to tackle these problems, we have come up with a program. The program is Prokriti. The tagline is সতেজ খাবার and সুস্থ জীবন. Now, to lay out the problem and to lay out the campaign and the program, I invite my teammate Arif.
This program needs to be run by Ministry of Health and Family Welfare with cooperation of Ministry of Agriculture. Now let's take a look at the program now. At first, there have to be motivational promotions, SMS based food supply, drug regulations. Let's take a look at them one by one. Promotional programs. First, we need to create a social awareness. Now, to create a social awareness, we need to start from educational institutes, schools, colleges, and universities. Now, how can we do that? At school level, we can introduce children with one vegetable each day or each week. Let them tell about the good sides of it, and also tell them about the bad sides of, say, street foods and vendor foods. Now, we can also introduce some TV programs, such as TV programs on healthy cooking shows, or TV serials, which will promote that what are the good effects of healthy foods and why we should not use unprescribed drugs. Now, on a yearly basis, there should be a health week. The health week should take place on Upazila levels. In these health weeks, there will be different programs. The first programs need to be weight measurement. In this weight measurement program, citizens will have the chance to measure their weights, and if they are underweight or overweight, the respective authorities and specialists will suggest them what to do and what not to do, what to eat and what not to eat. And there will also be display of healthy foods, healthy food products, fish, and they can buy it for cheap prices. Now, another and one of the most important thing is the drug regulation. The Directorate General of Drug Administration, which is a part of Ministry of Health and Family Welfare, have its offices throughout the country. So their different officers can work as a drug inspector. So what will a drug inspector do? He will go to pharmacies and check if they are selling or any unprescribed drugs, and they will also encourage not to sell them. At campaigns in hospitals and pharmacies, doctors will be encouraged to prescribe drugs only when it is necessary, and pharmacies will be discouraged not to sell drugs without any prescriptions. Now, most important part is SMS-based prescription. Let me explain this SMS-based prescription. In this SMS-based prescription, every citizen of this country will have the right that when they fall ill, they will SMS their symptoms of sickness to a specific number. Now, to whom this specific number will he or she SMS? The specific number will belong to the respective doctor from Upazila Health Complex or in unions. So, as the doctor gets these symptoms, if he thinks it is necessary to prescribe some drugs, or if he thinks to give him some suggestion, he will SMS him back, and through this SMS, he will get the chance. The patient will get the chance to go to a doctor, go to a pharmacy, and buy it. And this SMS will work as a prescription. The rest of the presentation will be conducted by PRs.
First, we need to understand one thing. If we eat healthy, we will live healthy. But this process is hindered by food adulteration process, and researchers have shown that food adulteration processes are mainly conducted by the middleman who brings the food from the producers to customers. In this IT revolution world, when all the spheres of the world are coming together, why is there still a gap between the producers and the customers? So we want to devise a plan to dissolve the gap between the producer and the customer. So that will ensure healthy food consumption, and this will be our SMS-based food supply. With a vision of Digital Bangladesh, government has imposed A2I, a program run under A2I's UISC. The UISC will create a framework of farmers' informations of the community. The information base can be accessed by general people through websites. Through websites, they will be able to place ads. Upon placing ads, they will get a specific number. The specific number will signify their buying order. Upon that placement, they will be told to pay 20% of the main price through mobile banking, which will help for the food to come from the producers to the customers. As the program is conducted by government officials, there will remain some freshness and there will remain trust. And with this program, we believe that we can transform our unhealthy, uncontrolled drug user, unaware, low life expectancy nation to a healthy, controlled drug user, aware of themselves, and a high life expectancy patient. Thank you.
Thanks for the presentation. You are doing therapeutic research, right?
Yes.
And you didn't mention research.
Actually, it was done by a faculty of East West University. His name
It's Mohammed Babu, and he was actually an MBA student of IBM.
Whenever, okay, I know, I understand. But whenever you cite any kind of research like this, you must acknowledge the person who has done the organization. My second question is, you're talking about drug regulation, right? But whenever you study with a problem statement and you're going to do a core analysis, never start with zero, because we are not at zero. There is a department for drug administration, and there are some regulations, there are some inspectors who are inspecting the dispensaries, and there are some practices. So we are not at zero. So we have to strengthen the fitness, right?
If I may add, actually our idea is that we know that we have a current situation where there are drug inspectors, we have a department, but we are saying that they need to, they are doing a good, very excellent work, but they need to do it, they need to go at doorsteps, at pharmaceuticals, pharmacies, and tell them that what to do and what to not to do. We are just saying that the situation is already there, but we are telling them to do it more, under this particular program, we are telling them to do it more violently.
And finally, you are promoting e-commerce to m-commerce, like
Yes.
right? And you are talking about UISCs like
Indian Innovation Services.
company services. And do you think that m-commerce is feasible in our country with the farmers who don't have mobile phones? Because last 2 months back, I went to village for a survey. I talked to farmers, and none of them could give me a single mobile phone because they are not using it.
Yes, particularly for that reason we have EYSCs. The EYSCs will work as a mediator between the farmers and the customers. The farmers who don't have an access to mobile number, they will go to the EYSC and they will sign up there, and they will contact with the customer through EYSCs. And
We believe that the people who are in the community knows the community best. As the UIC is situated in that community, they will know who produces what amount, and who produces what kind. So they can ensure it, and they can convey our messages to the farmers who don't already have an telecommunication method.
Activity framework. Can you just move to activity framework? Summary. Next slide. Alright, okay. So before I start, before I give you any question, before I ask any question in the presentation, I'm going to give you small feedback. That's whenever you're presenting, okay, whenever you're communicating to someone, try to make eye contact, because some of you are actually just sitting here and there trying to memorize the words or scripts or something. Okay, so it's nothing. It's not a memorizing speech competition. Okay, you're trying to present something. You're trying to communicate. So there are people out here. So whenever you're saying something, try to look at them. So that actually ensures better communication. Right. So this first thing. But I would say you were very close to the problem statement. You probably identified what should be done. Okay, so what are the issues? So good job on that. However, some points. For example, you have seen the second question. Says promote proactive practices over reliance on unnecessary medication. Do you think you have actually touched this point very well while describing the whole program? Or can you just mention some points which actually talks about the proactive practices
Actually, the Health Week, which we are suggesting to conduct, in this Health Week there will be programs in which proactive practices will also be encouraged, such as walking. Actually, walking is the main thing. You don't need to run.
Now you are coming to the point. Okay. So probably your whole presentation is based on the first question. Explain how the government can contribute to ensuring healthy food and vegetable systems, for example. Probably the government's or the governing body's role. Okay, probably the whole presentation mainly talks about how the government or the governing bodies and their role in ensuring or promoting healthy life rather than having antibiotics-based solutions. The second question is there, the hint is there, probably we have not touched it. We have some points like awareness, TV programs and health week, but you actually did not mention what are the things that you should cover. What are the aspects of living healthy life? So what are the healthy foods that we should talk about? What are the things people should do? What are the things people should not do? Then you are talking about running. Okay, make a campaign of 30 minutes walk per day. Okay, or cycling, good practices. So probably the second question is probably missed a bit.
Sir, if I may add, sir, the thing is that I think it will not be possible on a scale of a private sector to do these social awareness camps. So for government to run this Prakriti program, they will, through their awareness programs, they can say how to run or how to walk and all those.
Again, you're missing the point. I'm saying you're actually right on the aspect that what government or governing bodies should do. You have covered that part, probably, at least most of it. But what are the things that people should do? What are the things that you should promote as a part of IMC campaign? What people should do, what people should not do, what is the plan, what is the message you want to deliver, how will you deliver the message, what are the activities that you do, so that people get aware of the activities. So this part is probably missing here.
Just one. Okay. And if you go to the second slide. This one. It's a tip for you. Whenever you're talking about chart or anything, just look at the variables. Because you are using 5 variables here, but in 3 bars. You have 3 bars and 5 variables. So whenever you're presenting like this type of data, just split out your variables. Make the pyramid of 5 variables.
We thought that they're talking about 3 kind of problems.
Yes, sir. We thought that past experience and prior assumptions
Yes, clubbed doesn't work.
mean the same thing. That's why we clubbed it together.
Okay. And level of education and distance about definition.
As the people of Bangladesh are, most of the people are not educated. There is tendency of people, the doctors or the diagnosis centers to give out wrong results, and this results in lack of trust over the physicians. And if, as the people of most of the people of Bangladesh are illiterate, they cannot regain those trusts. So I think that these two should be clubbed together and fought in the same way.
Again, probably you have brought in another point here. Isn't the issue with level of education here? Isn't the issue with level of education?
It is about prior assumptions. Right?
Now tell me, which people take antibiotics more, the village people or us?
So, us.
It's us. It's not about education. So in some cases you have probably talked about the level of education or the illiteracy of the people. But the problem actually stays with the people of the urban places, us. We are actually being more educated. Being more educated, we actually think of, fine, I know there's the issues of this, we are probably having a headache or something. For any kind of issues, probably we think, fine, this can be a problem solution to this problem. Let's take an up, let's take a paracetamol. Okay. Having some kind of headache or something, or kind of bad issues or something, you take probably some antibiotics, that kind of other stuff. So being more educated is actually, issue is actually with the more educated person, not with the lower educated or illiterate